about the pronunciation difficulties. Pronunciation difficulties differ in kids as well as in adults also. Sometimes I have seen. I have come across lots of differences in pronunciation all over the world with the people, adults as well as kids. When there is a pronunciation difficulty in a kid, that may be oral structural difficulty, or the brain function difficulty, or learning difficulty, or cognitive defect, or any other exposure matter, which anyhow it's pronunciation as well as phonological. There are two types of pronunciation difficulties, it says in books. So pronunciation difficulties, we hear they differently pronounce, but these articulation difficulties can be corrected. It says phonological difficulties cannot be corrected, which comes from the brain signals. It can differ by a speech therapist. It can differently diagnose, as well as you have to go through the pediatrician and the team of surgeons sometimes. We'll say one by one. The pronunciations may be not happening properly. The child may have the tongue tied. The tongue is attached to the front of the mouth, which the child cannot move the tongue, can get different sounds, as well as at the birth they are less completed lip and palate called cleft lip and palate. They also can't pronounce properly. And also the submucous cleft palate, the palate get weakness in the end, which can make different sounds. And also for them eating and drinking, nasal regurgitation also can happen. If not level searcher for any child, we can wait till 7 years, because it is called speech immaturities. These immaturities can be corrected naturally by 7 years. Passing 6 years, by 7 they have to get it better. If not, you have to consult a speech therapist, speech and language therapist. And this level searcher is differently made in some kids only, not all kids get this problem, this speech immaturity. And also when parents talk very fast, they talk different languages at home or around the child, there are different accents, which makes the child's pronunciation also different, because they have heard it in that way, they pronounce that. And also the hearing difficulty of the child also can lead to pronunciation difficulty. So if a child is around you who is pronouncing differently, you have to think about these things. If it's difficult for you to think about, you get the consultation of a speech and language therapist, and the team of the consultants, the pediatrician and the surgeons and all will discuss what's going on later. So consider when they are making different sounds, especially we love kids talking immaturely, and also they use baby words. We love that, but I don't encourage it, because it's not good for the child's speech expression, communication, because with a different sound production they make different meanings of the words, which can damage the child's personality later. So if you have a problem, just think about that and change it by speech and language therapy.